Have you been diagnosed with a chronic illness such as heart disease, diabetes, or a prior stroke? Perhaps you're overweight and concerned about your health. Are you taking prescription medications and concerned about side effects or drug interactions? Or maybe you're not feeling your best. I'm Dr. Baxter Montgomery. I want you to take a few moments to learn more about the wellness program that we've developed here at Houston Cardiac Association. It just might change your life.
We appreciate what you're doing.
Thanks. Thank you very much. We were able to bring together for the first time individuals treated in our wellness bootcamp. The medical problems are diverse.
I have been diagnosed with osteoporosis.
Well, I'm a diabetic and I was severely overweight.
We were on the process of moving here from Denver, Colorado, and I had a heart attack.
I was scheduled for an amputation.
For some strange reason, I had high blood pressure. Well, it was considered that, and I was on 2 medications. And I said, no, I don't believe this is happening to me.
One thing I've noticed that over the years in treating patients in internal medicine, cardiovascular disease, our technology has gotten better while our patients have gotten sicker. So many people have heart disease. The number one killer of men and women aged 25 and older is heart disease. Obesity and overweight, the incidence is increasing in our population. So we're projecting that more people, they're going to have more individuals with kidney failure. Many of you may notice an increased number of dialysis centers that are sprouting out all over town. You know, we talk about environmental issues such as environmental pollution. We need to start with the number one environment, which is our bodies. We need to stop polluting our bodies. Once we stop polluting our bodies, we'll function at a higher level.
I don't want to be on medication all my life. So I heard about the program.
I saw Dr. Montgomery on television and I decided I'd call him and see if I could enter into the program, and I did.
I can't say enough good things about the program.
The program, our 4-week wellness bootcamp, is probably not what you think.
You can take this pie crust and spread it out.
We don't achieve wellness through exercise, vitamins, or supplements. We make a difference through food, the right kind of food.
Fresh beets with Fuji apples and ginger.
He doesn't like to say diet, but eating right.
With our program, food is your medicine. Nutrition becomes the answer to allow the body to cleanse, heal, and regenerate.
This is vegetarian gumbo, and we use seaweed to give it the seafood taste.
Our food classification system is a proprietary system that we've developed that I think hopefully someday will replace the food pyramid.
I don't have so many food cravings, and which is significant. It just gives you more of a sense of empowerment and stability.
A lot of foods that we consume are addictive. Many people who oftentimes will know what the right thing is to do in terms of what they should eat or what they should not eat. However, despite that, they have some cravings for these foods, some addiction foods. Oh, I know the barbecue's not right, but I'm going to diet tomorrow. I'll eat it today. The fried chicken, it tastes so good, I'm going to eat it today, despite the fact they know it runs their blood pressure up, it may run their kidneys or the like. So our program is one that it takes the individuals, put them in an environment where it allows them to change their mindset to their approach.
I find that most time we live to eat instead of eating to live. And the program that he has is excellent.
With the chronic toxic foods we put in our system, I don't want to quote names, but the hamburgers and the fries and the toxic foods that we consume with all the preservatives and the colored dyes and number 99, all of those substances build up in our system. So we have to allow it to cleanse, to allow the body to heal and regenerate. So the first step is remove all toxic foods from daily consumption. So we're pretty good at transforming food to toxic levels. You know, you can get okra from the garden and eat it. That's a nutritious food. But then you take the okra and you batter it and deep fry it. You transform it to a toxin. And we're very good at transforming foods to toxins.
Well, before I paid a little attention to my diet, but not much. But now I pay strict attention to the diet. And it's just kind of like a feeling of wellness now, you know. A lot of the pain and stuff is going away that I had.
Next step is to consume only the most nutritionally excellent foods possible.
Well, the most challenging part of it was giving up that diet that I had. previous to this diet. You know, giving up meat. I don't eat meat anymore. So that was a major change. I don't eat fried foods, anything, just fresh vegetables, raw vegetables.
A lot of people that I am with my age, they have this meat thing. And they'll tell me, we don't want to hear about your no meat doctor. But I say, well, what you think about me? I'm 81 years old. I say, what you think about me? You think my no meat doctor do anything for me? It would be silly to not do what he say when he's taken me off for insulin, that I've been on insulin twice a day since 87. So if I didn't follow what he told me, I would be the one that lose, you know.
Many individuals who successfully complete the Wellness Bootcamp report remarkable differences in their health.
I was basically medicated all the time. Had I not gotten on the program, I imagine I probably would have maybe lived about 5 years, would be my estimate, and it would not have been pretty.
I was taking 5 medications, 2 for diabetes, 2 for cholesterol, and 1 for acid reflux. After 6 weeks, I was taking off all my medication. My cholesterol used to be 365 before attending this program, and now it dropped 140 points. It's not normal yet, but I'm getting there.
The doctor said I'm a state-of-the-art patient because they scheduled an amputation they had to cancel. I'm a walking, living miracle.
So the heart attack has been a blessing to me. I mean, it sounds bad, but I feel great. I can't tell you how long it's been since I felt this good, but Dr. Montgomery saved my life. So he's been good. He's been good. So I can't thank him enough.
The inspiration for the HCA Wellness program was a 69-year-old patient diagnosed with a benign brain tumor that was successfully removed. However, she ended up dying from liver failure. That patient happened to be my mother. And this is in part why I'm so dedicated to addressing the sickness of the patients that I see on a daily basis. Because more pills and more procedures, while in certain settings they're important and they're beneficial, they're not the final answer. While our wellness program came too late for my mother, it has been able to change many other lives.
But I also found in the program a very good support system. And when you have that support and you can mingle with other people, I'm telling you, it works really good because it's really something that you have to put in your mind. It's a mindset.
Time anyone's done anything like this. The 4-week Wellness Bootcamp is not the end of a healthy lifestyle journey for these individuals. We also offer a maintenance program that teaches them how to incorporate what they've learned into their everyday lives. Of course, our best proof is in our wellness clients.
I just feel great about this whole thing. I mean, I can't stop talking about it to people.
If they truly want to be well and not just be managed and medicated all the time, go see the doc. Best thing that'll ever happen to them.